y'all, Dr. Woodus here. I'm in clinic today and I just had a mama ask me when is the first time I recommend bringing her daughter in for her first well-woman exam. And so that's a question I actually get asked quite a bit, so I thought I would jump on and chat about it. And so I typically want to see patients for their first well-woman exam between the ages of 14 and 18, and it really is just a conversation, and that's the first thing that I tell patients so that puts their mind at ease. In fact, you can see this like immediate wave of relief come across them when they find out that they don't have to have an exam unless they have a specific concern. So we just talk about what is a normal menstrual cycle, what's an abnormal menstrual cycle, what to expect during a normal menstrual cycle, how to take care of themselves. We talk about hygiene. I break out my models. I'm a very visual person. And it occurred to me that most people have absolutely no idea about their anatomy because they're not taught these things. So we talk about a vulva, we talk about the proper names of things. We talk about, this is your mons, this is your clitoris, these are the labia, this is how you take care of those things. This is what soaps to use, what not to use. We also break out the pelvic model. I show them the footrest, the stirrups. And I show them kind of what a speculum is. Most girls have never seen a speculum in that age group. So we talk about this is a metal one. We have plastic ones. I show them the different sizes. I break out my pelvic model and show them how this gets inserted and what we do during the pelvic exam versus the pap smear. I'll show them the brushes that we use for the pap smear. We talk about the purpose of the pap smear, how often it needs to be done. We talk about how it's for cervical cancer screening, but that we could also pick up infections like gonorrhea, chlamydia, yeast, trichomonas, bacterial vaginosis with the pelvic exam, the pap smear. And then we talk about, are they sexually active? What types of sexual activity are they having? Are they protecting themselves each and every time? Why it's important for them to protect themselves. We talk about STIs, which ones can be treated, which ones can't be treated. We talk about the implications of even those that can be treated because they can have long-lasting effects, and most young ladies don't realize that. We talk about unwanted pregnancy prevention. And when I talk about hormonal medication, I don't just emphasize birth control. We talk about how we can use those medicines for cycle control too, because young ladies tend to have awful cycles, like horrendous cycles where they're bleeding all over the place. Their cycles are unpredictable. They're having trouble with hygiene. They're preventing themselves or withholding their participation in activities because they're afraid of being on their cycle, that type of thing. So we talk about how we can use these medicines to hijack their cycle and give them some consistency, some predictability with their cycle, make their symptoms less pain, less bleeding, all of those things. We talk about HPV vaccinations, so we make sure that they receive their HPV vaccinations and help them facilitate those things if they have not received it. I explain to them why it's so important. Because HPV is the #1 cause of cervical cancer, and we have a vaccine to prevent that, so we make sure that they understand that. I offer them STD screening, and that can also be done in a minimally invasive way, so oftentimes we can get the information we need just by urine and from a blood test. If they do need an exam, we get real creative. So I'm not going to do anything to anybody that they don't want done. I'll often give them swabs that they can take to the restroom and collect samples themselves if that's what they feel more comfortable doing. So it really is just a conversation between the ages of 14 and 18. We cover all of those bases and we do what patients are comfortable with, really just to introduce this is what an OB-GYN is, this is what we do. Feel free to ask any and all questions. Happy to see you back every year. So just wanted to jump on and share that information with you guys because I get that question quite a bit. First OB-GYN exam between the ages of 14 and 18. All right, till next time.